Well, good morning. My name is Robin Lanzi, and I am thrilled to welcome everyone to our co-sponsored presentation today on rapid qualitative methods and implementation science, approaches and applications. Here at UAB CFAR, we are thrilled to partner with the UCLA and San Diego Implementation Science Consultations Hubs. We are part of a network dedicated to implementation science within the HIV epidemic. And really thankful to be able to partner with Dr. Alison Hamilton, Borsika Raven, and Nicole Stadnick on this. And so I invite each of them to introduce themselves, and then we will get started with Dr. Hamilton presenting. Just before they introduce themselves, to let you know, each of us will present for about 15 minutes.
Yeah.
And we will then invite you all to ask questions at the end. And if you would like to put your questions in the chat, we will each be monitoring the chat and hopefully be able to answer some of the questions in real time. And if not, we'll have time at the end to be able to ask questions and then also share resources and letting you know where you can obtain the slides as well. So Dr. Hamilton.
Sure. Thank you so much, Robin. And thanks for this collaboration, which is always great. Do you want us to do quick introductions, all of us, before we turn to the content?
Okay. Yes, that would be great.
So I'm Alison Hamilton. I lead the UCLA Rapid, Rigorous, Relevant Implementation Science Training Hub within the Ending the HIV Epidemic initiative. And I'm a professor in psychiatry at UCLA and a research career scientist at the VA Greater Los Angeles. Borsika?
Thank you so much. Welcome, everyone. My name is Borsika Rabin. I am a faculty at the School of Public Health at University of California, San Diego, and I am co-directing the San Diego CFAR Implementation Science Hub with Dr. Nicole Stadnick, who will come up right after me, and very excited to be here to share some of our experiences with qualitative rapid methods. Nicole?
Oh, great. Yes. Hi, everyone. Good morning, afternoon, and evening. I'm Nicole Stadnick. I'm faculty in the Department of Psychiatry at UC San Diego. Along with Borsika, as she mentioned, I co-direct our Implementation Science Hub with our Center for AIDS Research. I'm a clinical psychologist, public health researcher, and implementation scientist. And I had the great fortune of being trained by Alison in qualitative methods and analysis. So very excited to share what I've learned and how I've applied it in our work. Thanks so much.
Thank you. And I am Robin Lanzi, as I said, professor here in the School of Public Health in the Department of Health Behavior. And I am fortunate enough to also serve as National Director of Community Engagement and Translational Sciences for the National Center on Health, Physical Activity, and Disability with Dr. Jim Rimmer, and also to serve with the UAB CFAR along with Dr. Michael Mogavero as MPIs for our UAB CFAR Implementation Science Consultation Hub. And with that, I'll ask Dr. Hamilton to share.
Thank you. Lakin, can we go to the next slide? Okay, so we have a lot to cover today. We're just going to do a quick overview, and each of us is going to share different information with you that relates to working within a rapid turnaround time frame with your qualitative methods. So we'll talk about integrating theories, models, and frameworks. Dr. Rabin will talk about that. Dr. Lanzi will talk about team-based work in this space, and Dr. Stadnick will talk about crafting and disseminating products from your rapid qualitative work. So I'm just going to go through a bit of introductory material after we do a quick poll, and then I'll turn it over to Dr. Rabin. Lakin, can you take us to the poll? Thanks. So if you could just let us know how familiar you are with rapid qualitative analysis, rapid qualitative methods. You see your response options here. And Lakin will run that for us, I think. Are we just putting our answers in the chat, Lakin?
I can make a poll in like just a second. Sorry.
Folks are just throwing it in the chat. It's probably
Okay.
fine.
That's totally fine. Yeah.
Yeah, that's great.
Can you show the poll slide real quick, just so we can see where people's answers are falling? Okay, so I think we have a good number of folks who are maybe using it or know what it is, but aren't using it or don't know what it is. Okay. So in the interest of time, as people fill in their familiarity, we'll get going, especially because there are several who don't know what it is or maybe have never used it. So we'll continue on as you share your responses with us. Next slide, please. So we're going to do this rather quickly, but we do have references and resources for you. So don't worry, there's more material available. This is going to just give you a quick overview. With rapid qualitative research, what we've seen, especially in health services research, implementation research, we've seen the need for methods that help to accomplish our goals within often tight time frames or time punctuated time periods. Like if you have a phased implementation study, you might need to turn results around within each of those phases. So we tend to need to kind of curtail our use of qualitative methods in a more telescoped fashion, and often a more pragmatic fashion, where we really need to be able to describe quickly where something is happening, what is happening during that process, what were people doing before we introduced something new or took away something they were used to. It definitely puts different demands on the use of these types of methods. Of course, when we have teams, we are able to do this work more quickly, and Dr. Lanzi will talk about that a little bit later. And we're often also doing this work in a mixed methods context. So we're drawing data from a lot of different sources, and triangulating perhaps with quantitative data or multiple sources of qualitative data. There are, of course, trade-offs. No method is perfect. No method can do absolutely everything. So when we're using rapid qualitative methods, we might not have the time that we're used to if we're trained in qualitative methods. I'm an anthropologist, so I definitely wasn't trained in rapid work. I'm much more of the long-term, data collector, reflector, that type of person, but sometimes we simply don't have time for that. So there are trade-offs, but there are still criteria that we want to achieve for rigor, regardless of how much time we might have to use these methods. Next slide, please. There is an explosion, I would say, of rapid qualitative work going on. Certainly the work of Claudia Vindrola-Padros has been quite influential, as she took a look at the ways in which rapid techniques were being used, and found that the main reasons why people were using rapid were to reduce time and cost, of course, increase how much data was being collected, improve efficiency, improve accuracy, and obtain a closer approximation to people's narrated realities. And what we see a lot in the use of rapid is sometimes maybe not using transcription, which is one of those things that cost. And there are other techniques that folks have been using to try to turn this type of work around more quickly. Next slide, please. So again, this is a super quick overview of rapid, the rapid analysis approach that we use in our projects, and there are going to be some references if you need more information. Can you do one more slide, because this is a little animated, like and one more, I think. Yes. Okay. Thank you. So rapid analysis and these rapid techniques that we're going to be talking about are not well suited for all forms of qualitative methods. So if we think about qualitative methods on a spectrum from unstructured data collection to structured data collection, The rapid approach really falls much more on the right side of the spectrum in sort of the semi-structured area of it, meaning that there is a structure to the data collection effort versus maybe unstructured data collection that you might see in phenomenology, grounded theory, other types of paradigms where there's less of that telescoped approach to data collection. So you may even want to enhance your qualitative methods in a study that involves rapid turnaround by building in some more structured elements. As you'll see really briefly, the approach itself does draw on the structure of data collection. And so we want to kind of have a match between the way that we design the data collection instruments and the way that we analyze them and kind of situate them within the broader project. So it could be that even within your data collection efforts, you have a couple of more structured data collection components, or limit the number of people that you're interviewing, for example, make choices about your sampling frame that might help to get the work done more quickly. Next slide, please. We don't want to lose rigor when we're doing this work more rapidly. We really want to maintain a lens on rigor. And if you haven't read Sarah Tracy's paper about 8 Big Tent criteria for excellent qualitative research, I highly recommend checking it out. It's a really great way of thinking about what we're trying to achieve in qualitative research. And she defines rich rigor by using abundant and appropriate theoretical constructs, data samples, and data collection and analysis processes. So we definitely don't want to lose these components of rigor just because we're doing things more quickly. We want to maintain the spirit of qualitative inquiry and ensure that we're still accomplishing these criteria as we're doing this type of work. Next slide, please. Needless to say, when we're talking about a time-oriented approach to our use of qualitative methods, time is kind of bounding the entire endeavor. We might have, we've worked with people who have a week to accomplish their project, or a month, or 6 weeks, or 3 months. So really short time periods for doing this type of work. And that is best facilitated in our experience by this set of ingredients, all of which are really necessary to pull this off. And you'll hear more about this from my colleagues coming up. So we want to have potentially what might feel like more specific or targeted questions, perhaps less exploratory, less inductive questions, because we do have this more structured approach to data collection. We want to be sure that the team is prepared for this work, and you'll hear more about that a little bit later. We want to really emphasize the feasibility of our data collection and analysis approaches. And we want to have a very clear sense, as you'll hear about more from Dr. Stadnick, about what products are intended to be generated from the rapid analysis. And within the time frame of these projects, that is often not an academic publication, although you can certainly get academic publications out of this work. But oftentimes in the context of the actual turnaround of rapid methods, we're looking more at executive summaries and PowerPoint presentations, abstracts, different smaller pieces that may be really critical for implementation processes that aren't necessarily requiring the time that's involved in writing an academic paper. So we'll talk about this more later, but it's really the fit between these 4 ingredients that helps to ensure that you can make progress using a more rapid approach to your qualitative methods. Next slide, please. So there is a YouTube video that I did, gosh, maybe a couple years ago now, that describes the whole process in detail. So basically, to just go over it really quickly, what we do in the way that we approach rapid analysis, given the semi-structured parameters that I was laying out before was that each data collection episode is summarized using a template of domains. Those domains come primarily from the interview guide. And we're really emphasizing understanding what someone talked about in an individual data collection episode, or what a group of people talked about in the case of focus groups. From those summaries, which are pretty structured, we can create matrices and start to take a look across data collection episodes and use those to really start to identify key points, potential themes. You can use them to look at quality of data collection and also to inform where you might go next with your data collection and analysis processes. Certainly, we would really encourage you to think of rapid analysis as one of many tools that you might want to use with your data. So other tools that you might be used to, codes, memos, et cetera, are not, being abandoned. It's really thinking about which tools do I need for the job, for the products that I'm trying to generate right now. Next slide, please. And I just want to do a quick time check. Okay. These summaries that I mentioned are templated. And we're really trying to develop an inventory of what is in the data. This might be thought of as condensing data, which was referred to in Miles Huberman and Saldana's Qualitative Data Analysis Sourcebook. So we're taking what might be, in our case, if you're using transcripts, we're taking what might be a 50 or 60-page transcript and condensing it into a couple of pages of an inventory of the data contents to create sort of a sketch of the data collection episode. It can be really helpful if you are using transcripts to use line numbers so that you're cross-referencing what's in the transcript. It's giving you that guide for where to go for the content. And of course, you can write notes and memos about where content is strong. In your summary, you can say, this is the interview where the person said amazing things about this topic. So you know where to go for the in-depth information. There are definitely many using rapid techniques who are not using transcripts, and we'll give you those references as well. So there are a lot of variations on this approach. But I think when you tend toward using audio recordings for it, it might take a little bit longer than if you're using really good notes or transcripts. And we can talk about that later if you have questions about that. Next slide. So there are limitations, as there are with any methods. As I mentioned, this is not really meant for unstructured data. I think it's probably better suited for transcribed data, but there are many alternatives being developed. In a comparison to thematic analysis, the investigators found that those who are embedded in the context where data is being collected will have probably a little bit of an easier time doing the rapid analysis because they have that contextual knowledge. These are, as I mentioned, these are brief summaries, so they don't have all of the detail and nuance that we might ultimately want to incorporate into our products, but rather they tell us where that detail and nuance is. So the summaries will say, go back to transcript 5 for such and such information. The summaries, the completion of them can be variable across team members. And so it's really important to go through a process of test driving the summary template. This is all described in the YouTube video. And you want to look for things like how much is each team member putting into each domain, to what extent are quotations being used, and is interpretation being employed, and to what extent. We try to keep this minimally interpretive, this particular summarizing process, and leave the interpretation for other phases of the analysis. It might be considered insufficient analytically, although I think there's more and more success with publishing, and as long as you thoroughly describe what you did and it's compelling and makes sense, then it's seeming to, make the cut in terms of publications. And we don't want to use this as a substitute for rich engagement. It's just that all of the rich engagement that we might ultimately want to have with the data may not be possible within the time frame that we have in a given study. Next slide, please. As I mentioned, this approach has been compared to thematic analysis and fared well. I'm going to go through these quickly so I can turn it over to Dr. Rabin. Next slide, please. And here we go. So I will turn it over to you now, Dr. Rabin.
Thank you so much, Dr. Hamilton. I would say that, as Nicole said, I learned everything I know about qualitative or rapid very specifically from Alison. So the opportunity to share a little bit how we apply this in our own work is what I am taking on. And I don't know if it ever happens to you that you are sitting on a panel with others presenting and you are taking notes because you are learning so much. That's what's happening with me right now. So thank you for being here. I wanted to highlight a couple of things that Alison shared because I think that will nicely transition into the topics that I will cover very briefly. First of all, today we are unable to fully go through the process with you. As Alison mentioned, there is an excellent video that she created. Please visit that and follow that. I know that many of my colleagues use that to follow it step by step in their first process doing this, and they were very successful. And if you have questions, you can put those together and always feel that to someone who has used the process before. So again, that's one kind of limitation of today's presentation, but also an opportunity for us to expand on more advanced topics. The second one, I think about, when you mentioned, Alison, is almost like a continuum of, going from thematic analysis to rapid analysis of the extreme. And I find that when I am applying this, I am somewhere in between. So I am sometimes using the full, matrix-based, as you described, and sometimes some combination. And so I don't know if you will want to talk about that later, but it seems like there is a continuum. So if, you can kind of figure out where you need to fall. And then finally, I am going to talk a little bit about how theories, models, and frameworks in implementation science might be helpful in this process, with the caveat that there is still a lot to be figured out. And we had some advanced discussions with Alison about this, that sometimes actually using those constructs from theories, models, and frameworks can be challenging in informing a qualitative analysis. So those are things that we could talk about more. But I don't know if the audience is very well versed in implementation science theories, models, and frameworks. So I wanted to have just kind of a background slide that these are things that we are obsessed with as implementation scientists. We feel that they are very useful for many reasons, and I will show a slide in a moment why I think they are helpful. Very often we are dealing with models and frameworks in implementation science, and very infrequently we have theories available to us. More kind of public health or individual behavioral interventions are informed by theories, but in implementation science, most of our toolkit is based on frameworks and models, which if you look at the traditional definitions, are not going to be predictive, and directionality is not going to be assumed. They are more guiding and organizing, which lends itself really well to rapid analysis, actually, because the goal here, as Alison mentioned, is condensing the data, creating an inventory, organizing the data in a way that it's meaningful for many different people. And so if you go to the next slide, again, today we don't have time to dig into what implementation science theories, models, and frameworks are, but there are many excellent resources. This is one that we created. It's coming to its 10th anniversary soon. This is the DNI Models in Health web tool, as we call it. And if you have interest in kind of exploring models, great place to go to select models, think about how to combine them, adopt them, and use them, and then also assess them. So if we go to the next slide, it just shows you the general structure. Today, I am not going to get into the details of these. However, I'm going to share an example of how DNI theories, models, and frameworks can be applied within a study to guide analysis. Next slide, please. So I mentioned that I believe, and many of us in implementation science, perhaps most of us believe, that theories, models, and frameworks are actually useful. And there are many, many reasons why we think that. with a little bit of a qualitative twist here. They can help you ask the right research questions. If you use implementation science models, you can really tweak those research questions in your specific aims or evaluation plan to reflect that implementation science, multi-level implementation science perspective. They can also help you narrow the scope, so go, expand or narrow as needed to focus on research questions that are really meaningful in a given context. They can help you link the study aims, the design, the assessment tools. In the case of qualitative, it would be interview guides, focus group guides, observational tools, and the analytic strategies, and then the findings. And I even want to go further and say that from that, they can help you create actionable plan. And I think with the RAPID method, we most commonly use it when we need to come up with some action items to refine interventions, to make some operational decisions rapidly. And we can't go through the full qualitative analysis, but we want that decision to be informed by our partners. And then, of course, it can structure your instruments, the analysis, etc. We'll go to the next slide. I picked my top ways that I think theories, models, and framework can really help in the context of qualitative work and specifically rapid qualitative research. First of all, formulating your research question and how you integrate potentially this theory, model, or framework into the specific aims to guide then the data collection plan and the instruments that you use. Alison mentioned that you are trying to use a very structured instrument to kind of really lend itself to rapid analysis. Often these constructs within the theories, models, and frameworks can serve as a basis for structuring your interview. And then you might develop your data analytic plan guided by the constructs from the theory, model, and framework. I will show you an example where we did that. And then finally, when you present your findings, sometimes it's useful to organize those matrices by these domains that are identified in the theories, models, and frameworks, because they make sense for your partners. They are thinking about the intervention. What do we need to change there? What are some contextual things in the internal context that we need to change? How about the external context? So it's really a nice organizing framework. Next slide, please. So I am going to move on to very briefly share two quick examples, and neither of them are perfect, but both of them together will show you a little bit of how this can work. The first one is based on a study that is currently ongoing, and you can see Alison's name on it and myself. This is led by Dr. James Pittman and the team, and two additional members are acknowledged there to implement e-screening for suicide prevention in the VA. And it's a hybrid type 2 implementation trial that uses really a very nice mix of implementation strategies, and we use implementation science frameworks and a mix of rapid and then more traditional thematic analysis. So it's really kind of that mix. Go to the next slide. Since I am talking about D&I theories, models, and frameworks, I wanted to show you that the one that we use in this study, and we use it pretty heavily because I am very geeky about these frameworks, is the Practical Robust Implementation and Sustainability Model, or PRISM. And some of you might be familiar with it, but you certainly are familiar with the lower part of PRISM, which is REAIM. So it is basically expanding REAIM. This is the framework that we are using throughout this project for planning, evaluation, assessment, and presenting data. Next slide, please. So I earlier mentioned that one way that these theories, models, and frameworks can be useful is to structure your specific aims. So you can see here, and the protocol paper has all the details that I cited earlier, how prominently the different components of PRISM show up in the specific aims. So you can see the REAIM outcomes and the PRISM contextual domains mentioned. The structuring of the hypothesis is by these different subdomains. And then even this qualitative comparative analysis is using really the contextual component of PRISM to guide the process. So that is one way that these theories, models, and frameworks can be useful and carried through. Next slide, please. Then, of course, we get into data collection, and I'm skipping a lot of steps, of course. This is a very kind of bird's eye view of our data collection plan. one component of it, the interviews. And so what you will see here, there is an opportunity by using PRISM to look at information across the board longitudinally. So you can see the first column is the pre-implementation questions, interview questions, which are very broad. Alison was who advised us to keep it very broad early on, but we were able to still connect PRISM domains that are relevant there. Then we are doing another set of interviews post-implementation, and you can see that there you have a little bit more specificity. Again, we linked them with the PRISM domains and also REAM outcomes. And then moving on, the sustainment interviews also align nicely with the previous set of interviews, and we linked them with the PRISM domains. So this serves multiple purposes. First, we made sure that we are asking questions that are really hitting on those key contextual and outcome domains. So when we develop the interview guide, we are using these domains parallel to the development of the questions, and we look for gap analysis, basically. Are we missing any key context domains or outcomes that we want to learn about? The second thing is that as we go left to right, we can look at things, how they change over time. So we can think about, what did we learn pre-implementation about organizational perspectives of the intervention and how that kind of concept evolved over time. They're not the same questions, note that, but they are linking with the same idea. So it allows us for that nice longitudinal thinking. And if you go to the next slide, I was worried that the previous is too big, but here there is a little bit more kind of zoomed in version where you see similar questions coming in post-implementation and sustainment. Again, we need to change them because we are in a different stage, but they are hitting on the same domains often. So we are expecting that we are going to learn about these over time. So that was one piece. If you go to the next slide. And then this also comes up. So this was kind of the design of the interview guides, right? When we code, we also are very closely linking back to PRISM. And this is where I said it's a little bit controversial. So we have thematic codes that emerge from the questions, but we are also coding them with PRISM domains. And it's tricky, but we find it very helpful. And so you can see here that we are really drilling down on what these different codes mean within the study, and then even linking them back with questions whenever relevant, although not always we find, these codes show up at that question, but it's good for us to have a general sense that, under this question, these are kind of domains that we expect to see. So that's kind of another piece that the theory, model, and framework constructs come into play during analysis. And for a rapid idea, this could be actually the set of codes you use, although I would love to have a discussion with Alison whether she would recommend that. Moving on very quickly, a second example. This is a study that, we can go to the next slide, Laken. This one is a study that is a paper that's under review. So I can't tell you whether Alison is right yet with this one that they will actually publish it. But we used a rapid analysis in this case because we used the data to refine an intervention that was actively being implemented. So this is the method that might be also interesting to you is brainwriting premortem, which is a way of learning about how interventions will fail. I cannot talk about that today because of time constraints. The more important piece is that it was informing the co-creation of COVID-19 testing strategies. And as you can see, Nicole and I are leading this activity. And basically what we did was asking patients and providers within an FQHC why the testing program that we proposed and we had to put into place pretty quickly will fail. And we asked it in 2 different time points. And the data that we generated through this process, these were kind of interviews, right? We had to know what we learned very quickly to change the intervention. So the rapid method really made sense in this case to us. And the key reason was not to get a paper out of it, but to inform what we need to put into place in these FQHCs during the COVID pandemic. If you go to the next slide. So you can see that we have a description, and again, this is not yet available, but hopefully it will be published, describing our process of doing the rapid analysis. We still had rigor, as Alison mentioned. with linking to theoretical constructs in general, but also we did some double coding of the data. So it was not just one person pulling out themes, but it was multiple people initially. And we also had a verification. So I went through everything and verified whether I agreed with the approach. But it was used in an Excel table. It was an Excel file that we set up with the different themes. And if we go to the next slide, it can show you how we linked. So this is our interview guide. So the brainwriting has very few interview questions. We ask a little bit about the participants, their experience with the health system, how that has changed during the COVID pandemic. And then we ask them to come up with these failure points, why this program will fail after we describe it to them. And we ask them to come up with solutions. And so what I'm showing here for patients and providers, the two sets of questions, how we came up with these rapid codes or structured codes. And so these are linked to the questions, pretty straightforward, linear way, and then put those into the Excel file. And then within the failure points, we actually created subcategories that made sense after the initial matrix was created. And then that was used, if we go to the next slide, to come up with solutions. So for each failure point that was identified, sorry, this is still just showing these subcategories of the data that we came up with under failures. And I'm not digging into this today, but just you can see that within each failure, there are some subcategories. We can go to the next one. And then these failures then are lined up with specific solutions. And then we actually had action items on our project of what we changed for that intervention to address these failure points and solutions. I do think that this is my last slide. Let's check. Yeah, these were meant to be not here, so we can move on. Thank you so much.
Okay, excellent. I'm going to take over now for the next few minutes. And it's wonderful to see more people join as we go through these different topics. So I'll be sharing a little bit about crafting and disseminating products from your rapid qualitative work. And if we go to the next slide, as Dr. Hamilton mentioned at the beginning, rapid qualitative analysis often has a goal of producing actionable results and findings that can inform your current work or that of the work of your partners. And so a key product of rapid analysis is often obtaining a quick, accessible snapshot of what's in your qualitative data. It can be a really helpful starting place. As we've seen, you can use summaries of your qualitative data to inform subsequent waves of data collection. And also, I found it really helpful to take just an overall view of what have we learned so far. Have we reached saturation, for example? Are we hearing the same topics or ideas, and we don't need to collect additional data or perspectives? Or are there still unique perspectives that we're hearing from people, and we should continue our data collection? As Dr. Rabin really nicely illustrated, our rapid analysis, if we go back to the last slide, our rapid analysis can also help us develop and refine our coding approach. So we can, oftentimes we're starting our interview guides informed by a theory, model, or framework. As we're then reviewing our summaries, we can determine if those domains from our theory, models, or frameworks are appropriate for a more structured coding approach. In addition, our rapid analysis can help us assess the quality of our data collection across our team members. So it allows us to check in with our team members, and we'll talk a little bit more about who can be part of our qualitative data collection teams in a moment. But it can help us assess, our interviewers, collecting data in a uniform way. What are they learning uniquely or differently across the data collection episodes? And then importantly for the academics in the audience here, our rapid analysis, usually kind of on a longer term basis, can help us prepare reports, presentations, and manuscripts. These can be, policy briefs. These can be presentations back to our community partners when we're conducting community engaged work, and then obviously manuscripts and peer-reviewed journals. So if we go to the next slide, I think I wanted to share a really nice new piece that was published. And I see some of the co-authors in our audience today, Dr. Harkness and Dr. Hamilton, obviously. So this paper here illustrates some recommendations for health equity researchers. I think many of you might identify as such. How kind of best practices and recommendations for rapid qualitative analysis for health equity research. And so they came up with this really wonderful acronym, EARS, to help us remember some of these recommendations. So employing rapid qualitative analysis to address rapidly evolving urgent health equity challenges. This comes up a lot in our HIV work, as well as in the past couple of years with the pandemic. Assuring quality and rigor throughout the rapid qualitative analytic process, responding to barriers and problem solving as needed, and strengthening community relationships before, during, and after using a rapid qualitative analysis. And on the next slide, I showed this really nice table that they have in the paper that just provides a bit more detail as to how you might apply these recommendations. So, for example, in the employing rapid qualitative analysis to address those rapidly evolving public health and health equity challenges, you can use your rapid qualitative analysis during these rapidly evolving health equity situations to, for example, as we did with our COVID-19 testing program, to make some kind of rapid decisions about how to refine programs to make sure that they're reaching, underserved communities or the communities who are having a difficult time accessing, health interventions. If we go to the next slide, I think I have an example from my work about using rapid qualitative assessment methods in a mixed methods design. So we can incorporate both quantitative and qualitative data methods, again, to inform programs. So this particular work, I was looking at an integrated mental health care model for children with autism. And so we collected information from pediatricians, from different healthcare organizations, both through a quantitative survey to assess the impact of the program, and then to expand on those survey findings, we interviewed them to really understand, what was helpful, what was not helpful about the program. And I have just an example here of how you might write up your rapid qualitative assessment methods. Sometimes that can be, when you're submitting these to journals, reviewers might have questions about, well, what does rapid qualitative analysis really mean? Is it really rigorous? So here's an example of how you might write it up. And on the next slide, I think I have, this is an example of a joint display. These are one of my favorite tools to really show mixed methods integration. And so again, I used rapid qualitative methods to analyze my interviews with pediatricians. And I summarized those using an implementation science framework called EPIS. This is the Exploration, Preparation, Implementation, Sustainment framework. So I organized my quantitative and qualitative data by this implementation science framework, and joined the qualitative and quantitative data together in this joint display table. And I pulled out illustrative quotes from the interviews to really demonstrate some of these EPIS-informed contextual barriers and facilitators of why this integrated care model worked or sort of needed refinement. So again, this is just an example of how you might show and demonstrate your use of your rapid qualitative methods in a publication. Let's go to the next slide. Oh, I think I'm actually going to pass it over to Robin, which is good timing. We have about 13 minutes left. So thanks, Robin.
Yes, thank you. So really, again, my training too from afar is under Dr. Hamilton too. So I want to give her all the props here and just really thankful to be in this esteemed set of colleagues, and thrilled to share a little bit about assembling a rapid qualitative methods team and some considerations and really an unlikely way to apply, I think, in some ways. So next slide, please. All right, so first of all, what are some considerations? Certainly this has been touched on some throughout, so I won't spend too much time on this, but maybe to add a little bit to it, certainly there are various roles that can be played when we are doing rapid qualitative methods. So you have your interviewers, obviously, and then ways to summarize it, developing your summaries and looking at ways to summarize those. I'm probably stretching rapid qualitative methods in some ways and applying this in my next example here, but ways to even take meetings and ways that information is shared, not necessarily gathering by interviewers, but also through ways of looking at information that's presented and wanting to consolidate that. So I'll get to that in a second, but certainly in a traditional way, those are considerations. Those who will be actually helping to do the analysis, we need to think about what their training is, what their background is. Are we going to include our community partners? How can, and I would advocate, of course, and how to do so. So wanting to make sure that that's the appropriate touch points. And I would say that's at all touch points. So including our community partners really as we're developing our methods and looking at the questions that might be asked, and then reviewing the responses and being part of looking at what are those, the nodes and the summaries. And so aligning that and looking at the optimal number. I wish I could say it's X number, but I would say it's really optimal in the sense of what helps you to get to sufficient saturation and alignment with your aims. I would also say that needing to look at touch points for that as well. When you would be circulating it to your community partners and having their input and thinking in the end, like what in the end do you want people to know? Why are you doing this? And are they able to help review and integrate? One of the things that I've learned along the way is the need not just to be able to do the qualitative methods, but have an understanding of the data, right? So there has to be both. And often if you think of like biostats, they can run the analyses, but we can also often just understand it and report back, versus I feel like here in rapid qualitative, and I hope I didn't offend any biostats people with my comment there, but when we think about rapid qualitative methods, I do think that there needs to be really this understanding of the data and being able to help summarize. So just a plug for thinking about both elements there. Okay, next slide. So our unlikely place, I would say that we're trying to currently apply this is in the ending the HIV epidemic implementation science consultation. I would say consultation hub, but more it's really for the alignment of all of the various supplements and bringing us together, and really fortunate that Donna Porter here, our associate director with our UAB CFAR, obtained the meeting supplement. So we hosted it this past fall, and with that, with NIH and ISKI and our all of our hubs really through the executive committee, planning what the meeting objectives would be and ways that we can really take what we're learning through the EHE implementation science supplements and then apply them for what are, so if we go to well, let me just say that for our meeting objectives, that's kind of broadly what we wanted to do, was be able to share our best practices and lessons learned, and then apply them from what was presented to each of the individual supplements, and then looking at deliverables. So broadly, that's what we were looking at. And we couch these in different categories based on their methods or focus. So here you see it's community-based outreach strategies, and then taking the clinic to the community. And with the next slide, please. Here we can see strategies for improving clinical care. And then looking at the next one, which my eyesight is not very good, exploring intersectional vulnerabilities and social and structural determinants of health. So we had that grouping. And then really fortunate to then do breakout groups to discuss what was just presented. And on the next slide, I'll share what exactly they were asked to present. But we had breakout groups that really then discussed what was just shared. And then thankfully, we had our NIH there who would sort of share a call to action and where do we, what do we come away with and where do we go? And so in the next slide, sharing. So what we asked the presenters to share was, of course, who they are, their team and partners, what their aims and key questions are, and then what their implementation science methods are. And then key to that was, what are your challenges and associated solutions? And then what are your lessons learned and best practices? And sort of employing this rapid qualitative analysis, we did assemble sort of an interesting team to implement this sort of method. If you could go to the next slide, please. And coming away with, and this is going to be submitted, so please know that this is hopefully going to be published, and really thankful for everyone, the whole list of people who are listed, but looking at ways to take this, what was shared, and summarize. And so I'll get to the touch point basically here is that we were able to really, I think, employ some of these methods to then in a very quick way be able to share back what was learned in a way that can be used in a very real way for our partners, our community members, our investigators, and NIH. And thankfully them also reporting back to Congress. So I think at many, many different levels, being able to use this information in a very quick way. Alrighty, so in the interest of being able to have time for questions, I know we've had some in the chat. I will go to the next slide and just make a note that we do have an implementation science resource box that includes a lot of this information. And if you would like, just please reach out and we will share that with you. And if we go to the next slide, there are many helpful references for rapid analysis that we are sharing and have noted here. And this will be part of our recording that will be uploaded. So if you go to the next slide, please. Wanted to for sure have linked here Dr. Alison Hamilton's Rapid Qualitative Analysis seminar that is really a seminal seminar that we all should watch. So it's linked there for viewing in the future. And the next slide has each of our contact information and Twitter handles, as well as acknowledgement of our funders and acknowledgement, of course, through NIH and their funding, and really thankful for them. And I have to say with my analyses too, that we just talked about, certainly Dr. Porter, Dr. Allison Barley and CC Wolfner, as well as all that we just discussed. And so we will have a recording available on our YouTube channel that is noted here. If you do have any questions, please just reach out to me and we'd be happy to share that with you. So maybe in the final 4 minutes that we have, we could entertain any questions and maybe, Lakin, if you don't mind, stop sharing the slides so we can see each other. Okay, great. Okay, I see a question. Let's see. Can you talk a bit more about how to successfully train people to effectively conduct rapid analysis summaries it requires getting grasp of project aims, data, and IS constructs. Any guidance tips? So I could take that for a second and then welcome the team here as well. I think one of the big tips for sure is knowing implementation science from the start. That does help. As I was saying, it's nice to know how to do qualitative methods, but without having some knowledge around implementation science and being able to tie it back makes it difficult, as well as the content area to being able to alignment. So that's sort of from the get-go, some tips that I have. Anyone else from the team?
Yeah, but it's a great question. I would also say that, not everyone on your qualitative team might be collecting data. Not everyone might be doing interviews, et cetera, but you can engage a wide variety of people in the analysis process. And so at a minimum, you would want people who aren't familiar with the guide because they're using it on a regular basis to get familiar with the guide, because the process is very much driven by the way the interview guide is set up. If you're using this for interviews, of course, you can use it for other data collection approaches as well. And so you need folks to be familiar with the interview guide and ideally be engaged in the process of formulating the domains that you'll use in the summaries, so that everyone has an understanding of what that correspondence is between the questions and the domains. And you may need to do a couple of cycles. So to me, the best way to get people familiar with this is to actually have them practice it. And we tend to have everyone take the template that's been drafted and summarize independently 2 or 3 transcripts that represent sort of a typical interview, not an interview that didn't go as planned, because that's going to be a little bit more difficult to get started. But if you have a few interviews that went as planned, hopefully, and everyone independently summarizes them, and then you can come together and compare how you engaged in the process. So looking for things like how much information was put, to what extent are direct quotes being used, is there cross-referencing to the transcript if you're using transcripts, and that may, depending on how people take to the process, it may require more than one cycle. But there's really no substitute for just kind of getting in there and trying it out and seeing how everyone on the team responds and reacts to it, how comfortable they are, what the issues are, and trying to achieve some norms across the team of how the summaries are going to be completed. And you'll still want to spot check whoever's most familiar with the process on the team, should ideally spot check people's summaries throughout the course of using this technique, and also make sure that anyone who is using this approach knows that they could go to the interviewer if they have questions, or go to a more senior team member and say, this was a really tough summary, I'm not sure if it's quite what it's supposed to be. And so having people spot check summaries can also be really helpful in terms of training. So I would say getting in there and trying it is definitely the way to go. And that's going to be important no matter how experienced you are, because every project is different when you apply these techniques. And so you really want to make sure that you're restarting with the process each time you launch a new rapid analysis. And I see we're at the end of our time, but feel free to reach out to us if you have questions, and we can look at other questions that are coming up and share resources that will respond to your questions as well, just taking a quick look at them.
Yeah.
Thank you so much, everyone, for joining us today for this brief rapid chat.
Rapid chat on rapid analysis. Yes, thank you. And thank you to Lakin Grissom for helping to organize this as well. So appreciate her. So yes, be on the lookout for a posting on this, and reach out in the interim. Take care.
Thanks, everyone.
Thanks, everyone.
Bye.
Thank you. Bye.
Take care.